Good morning, everybody. It's Thursday. Happy Thursday. Everybody's doing good. We are back rolling into our panel review. Our intent today is to discuss Marion County. We started off on yesterday, going over just the general background for Marion, but we'll do a call for conflicts before we start. But Carly, let's have you take attendance. And it's like Sarah Adelhart had to hop out. We'll be hopping back in.
Okay. Amy, are you here? Dharma? Keisha?
I'm here.
Hey, Keisha.
Yeah.
Morgan? Ron let me know he's going to be absent. Same with Seb. Abby?
I'm here.
Ariana?
Here.
Ane? Dana?
Good morning. I'm here.
Good morning. Daniel?
I'm here. Good morning.
Good morning, Daniel. Danielle?
Here.
Hi, Danielle. Drew? Elizabeth?
Here.
Emily?
Here.
Evelyn? Grace? Gregory?
Here.
Greta?
Here.
Hannah?
Here.
John? Juliana?
Here.
June?
Here.
Kathy?
Here.
Kylie?
Here.
Kirsten? Liz?
Here.
Mark?
Here.
Maya? Megan? Michelle?
Here.
Nicole Corbin?
He's
Nicole,
out today.
oh,
Sorry.
thank you, Sam. Nicole Egler?
Here.
Rachel?
Here.
Sam?
Here.
Sarah Adelhart? Oh, is she back yet?
I'm back. Got it fixed. I'm here.
Okay, perfect. Sarah Hubner? Sean?
Here.
Stanley?
Here.
Tammy? Tatiana?
Good morning. I'm here.
Good morning. And Tim?
Here.
We have quorum with 26.
Wonderful. Thank you. Just quickly before we jump into the call for conflicts or Marion, and I want to flag for Stanley, who I know has been really under the weather, and Sarah Adelhart are up first for Allied Health Services. So for Jason, Kylie, and Kathy, if you could be on deck to support. I quickly want to share our progress so folks get a sense of where we're at. You on the right, panel reviewers, we have completed 28 of 36 counties. Many, many thanks and kudos. This is a big job and it is a required job. So I appreciate y'all continuing to show up and participate. And the OAC, which is the illustration on the left, has approved 6 counties. So thank you for all of your hard work, and it's helping a lot getting the process moving. And your deep conversation is really helping inform the OAC and their decision-making process. So it's a good day to celebrate just a minute because I know we're all in it with our heads down. So I'm going to go ahead and screen share and start with Marion County and pick up where we left off and make sure I do a call for conflicts. And let me do, here we go. Call for conflicts on the providers that will pop on. There we go. The list is Allied Health Services, Tigard, Boulder Care, Bridgeway Recovery Services, Church at the Park, Community Services Consortium, Confederate Tribes of Grand Ronde.
Abby, are we supposed to be seeing
I'm just seeing email right now.
Oh, you are? Well, that's
Yeah.
not what you want to look at. Thanks, Sam. Let me try that again.
Yeah.
Better?
That's excellent.
Great. I'm sorry. No one wants to see my email. Okay. So the list of organizations on the right, I left off with Confederated Tribes of Grand One Community of Oregon, HIV Alliance, Ideal Option, Iron Tribe, Marion County Health and Human Services, Mid-Willamette Valley Community Action Agency, Painted Horse, Recovery Pathfinders, Soaring Heights Recovery Homes, The Fourth Dimension, and WVP, Health Authority doing business as Mid-Valley IPA, and Youth Era. So are there any actual or potential conflicts of interest in Marion County with any of these providers? Okay. And folks who were unable to join us yesterday, we have done all of our introductions, but I will remind anybody new who's tuning in or watching today. I want to start it with our objectives. The panel may meet as many times as necessary after reviewing the applications, which we have all done, and provide final funding recommendations to the Oversight and Accountability Council, the decision-making body for these drug treatment recovery services funds, dollars and grants to behavioral health resource networks. And to the greatest extent as possible, we should be recommending at least one provider in each service area. And our goal is to complete a majority vote for each of our 36 counties. We're diving into County 29 for consideration for the OAC. So just remember, we are recording. Many thanks again to Carly for her support to make sure all of this happens thoughtfully and well. Make sure to not share protected or sensitive information, or please use caution when sharing any information about an applicant. This is a discussion about what was provided in the application itself. The chat feature is not closed, but we'd like to try to keep it as closed as possible. If you have anything of any comments about the applicant, ahead and verbalize that. We'll use the chat for, be right back, I'm back, making sure we're capturing the motions accurately. And I will also use the chat to make sure that folks know who's on deck for presenting. Please try to condense your input. I put that in the email this morning. I really want to get us through the entire county of Marion today, this morning. That would be amazing. And so please try to summarize your answers to the questions that I'll put in the chat. And we've got M110 team on deck to pull up additional information as needed. And when we review all of the providers, we will do a vote. We've already gone over the Marion County overview. It's in your slides if you would like that information. In summary, there were 17 applications. The countywide formula is 28.7 million, and the ask across the county was 75 million, which is $47 million over the formula. So we got a big task today, and I know we can do it. All right, here we are at our home screen. You'll see the orange highlighted providers on the left side of the column are folks who are existing grantees who are reapplying for funds. If the cells to the right are in green, that means both of the two reviewers recommended funding that service area. If it is in blue, that means one of the two reviewers recommended funding in that service area. And if it is in orange, that means none of the two reviewers recommended funding in that service area. I'm putting the questions in the chat for you to cover. The program costs are indicated there, and you'll see, like with Marion County Health and Human Services at $4.6 million, we might have questions about what is in that dollar amount. We also want to know who the CMHP is for the Marion County community. And the priority score on the right is simply a way of looking at how thoroughly applicants answered questions that are the priority of the OAC, which include culturally and linguistically specific services to traditionally underserved and marginalized communities, from the LGBTQIA2S+ community, gender affirming care, folks with disabilities and other underserved populations. And then finally, the question about whether the organization will be providing services that are not billable to Medicaid and that they will not be supplanting Medicaid. So that's on a scale of 0 to 12. And you also see the reviewer average score just to the right of the entity name. Okay, we're diving into allied health services. I think that is Sarah. And if Measure 110 team can be on deck if Sarah needs an assist.
Sure. I will start reading the answer to question 7. CRC Health is dedicated to providing trauma-informed, culturally and linguistically inclusive services. Our staff undergoes comprehensive training in trauma-informed care and cultural competence, focusing on safety, trust, and collaboration. This approach, based on SAMHSA's guidelines, is integrated into all service areas to create supportive environments that empower individuals and prevent re-traumatization. At admission, we assess for trauma and allow patients to decide when and how to address it, building trust and empowerment. We also offer a Seeking Safety trauma recovery group, an evidence-based model for treating PTSD and substance abuse. Through ongoing clinician training, CRC Health ensures care is trauma-informed, patient-centered, and sensitive to individual needs. We prioritize cultural competence by understanding and respecting the cultural beliefs, values, and practices of the populations we serve, with staff from diverse backgrounds receiving ongoing training to ensure our services are sensitive to diverse community needs. Additionally, we address language barriers through interpretation and translation services, making our services accessible to individuals with limited English proficiency and ensuring that everyone can access the care that they need, regardless of their language proficiency. The CTC Group's policy on cultural competency and diversity promotes sensitivity and adherence to this philosophy across all centers. Employees are required to acknowledge and sign the policy during orientation, with documentation maintained in personnel records. Each CTC develops a cultural competency plan tailored to local demographics, addressing factors like culture, age, gender, and language. The plan integrates patient data, staff experience, and community resources. Ongoing staff training fosters cultural awareness, covering aspects such as traditions, health values, and attitudes towards substance dependence and mental illness.
Thanks, Sarah. And they're applying for SUD.
SUD and harm reduction. Yeah.
Okay, can you answer the questions that are in the chat about those two service areas, please?
Sure. Give me a second to navigate here.
I can help you. I was the other one.
Oh, great,
hey,
thanks.
Stanley.
No
Good to
worries.
meet you. Good to hear you.
For Medicaid, they're able to, they're eligible to bill for Medicaid and other insurances, and their annual budget will allocate it to direct patient care, specifically for medication assistance treatment services. That is for their SUDs. And then, well, that is one. And then for the substance, they're going to develop personalized care tailored to each patient, unique medical and behavioral health needs for counseling. And then I have the harm reduction, Sarah, if you want me to do that one too.
Yeah, thank you.
No worries. Harm reduction program will activate and engage with the community as expected, to increase the client's clinic's patients and promote patient retention by providing targeted outreach, education, and harm reduction services. And then there was a little ad that was extra. Medication is administered at the OTP facility, a mobile unit, through take-home doses, or at a partner site, off-site facility. And then they also just added that combining harm reduction with counseling services to help long-term recovery.
Okay, thank you both. That's all of the prescribed questions. Are there any other inquiries or questions about this application? Okay, thank you both. Much appreciation. We're going to move on to Boulder Care. That's Tatiana and Stanley still.
Yeah. I don't know if anybody's here, but I can read 7. I know that you asked us to continue with the cycle of reading 7, even though it's the same as the other ones.
Yeah, I mean, if you can, yeah, I'm sorry, but I think we have to for consistency's sake.
No worries. It's the same as the other one. Boulder Care is committed to providing intersectional, culturally, and linguistic specific services to patients. Boulder maintains an active organization-wide diversity, equity, and inclusion program that engages staff in ongoing discussions and education topics using both internal and outside expertise. Boulder is focused on a variety of issues affecting its diverse patient population, for example, anti-racism, the intersection of race and the war on drugs, language education, specific populations, Native Americans, criminal justice, and how it mishandles addiction, harm reduction principles. Boulder Care prioritizes a diverse care team, including clinicians, care advocates who will provide care themselves and help educate the larger care team staff based on their own lived experience and unique perspectives. Currently, Boulder team is comprised of the following. 33% of the clinicians and clinical staff identify as non-white, Black, Indigenous, Hispanic, Latinx, Asian, or two or more races. 80% of the clinicians and clinical staff identify as female, and 20% as male. 3.6% of clinicians, clinical support staff identify as LGBTQIA+, or two, spirit, eligibility, and then the next question is for Medicaid. And they are able to what do you call it? Eligible for Medicaid and other insurances.
And so they're applying for SUD, peer support, and harm reduction. With SUD, it's a $3.2 million ask, and usually they're asking for the financial support to help
For telehealth.
For telehealth for folks that are either underinsured or uninsured. Is that
Correct? Same as yes.
same? Okay, and peer support usually is accompanying the treatment and doing some outreach by phone.
Yes.
And the harm reduction is usually
Narcan
navigating
distribution, yes.
and distribution with folks who are in the communities, but not them themselves.
Correct.
Great.
And then they also had a section that said care navigation or case management services.
Okay.
When additional resources would be beneficial. That was another little section they added.
Is that part of the harm reduction?
It was just a
Yes.
bullet point. It
Interesting.
it was its own highlighted section.
Okay. Okay. Any questions? Thanks, Stanley.
No problem.
Next up is Bridgeway Recovery, and Zeb is not here today, and Tatiana is here today.
Good morning. I'm just pulling that up. I hadn't seen it on the cheat sheet for today, so just give me a minute and I'll circle back. All right, one more time, the name of the partner.
Bridgeway.
Bridgeway, okay.
I have that available if you want me to read that. It's only a one line.
Yeah, if you will, and then I'll pull up the score sheet to see if there's any other feedback we want to share. Thank you.
Perfect. So for number 7, for Bridgeway Community Health, they provide culturally and linguistic specific services to various cultural communities. That's it.
Thank you, Kathy.
Mm-hmm.
And I'm going to put this in the chat. It's ugly. I'm sorry. But just a little more information about who the reviewers are, and they should be in your emails from this morning and from yesterday in the yellow section for the Marion County. So Bridgeway Recovery Services is applying for screening at $494,000 and assessment at the same amount. And the SUD ask is $5.8 million. They are a current applicant. And for SUD, the question is, what are they providing that is not billable to Medicaid or other insurance?
Okay. They say Bridgeway Community Health seeks funding to integrate an evidence-based contingency management program into our outpatient services. This program will incentivize attendance with rewards addressing high no-show rates and improving treatment outcomes. With a $300 cap per client, a capacity of 500 clients annually, the CM program aims to reduce missed appointments. They don't really go into too much detail of what else is not covered by Medicaid. And their screening, well, I'm looking for their peer and they don't have that listed on here. Their housing is transitional and supportive. And it doesn't say if they're, these homes, stabilization housing, Bridgeway Communities Health response to an ever-present gap in the continuum of care where low barrier housing is needed by an individual to better support their journey in the recovery process. Stabilization housing addresses a critical gap in the continuum of care. These homes offer immediate support for those awaiting residential care, permanent sober living, or transitional from residential treatment. So it sounds like they have on-site peer navigators for these homes as well. So it sounds like it's integrated with the peer services.
Thanks, Kathy. And I'm going to make a correction that we're hearing about live while Kathy's talking. Could you share what's their harm reduction menu?
Kind of difficult to locate stuff in here. Go ahead, Tatiana. If you have something, that would be great.
Yeah, for harm reduction, they talked about the importance of a new mobile van that they're hoping to launch to deepen outreach and to address transportation barriers. One of the strengths in this was also that referral and linkage to both dental and primary care using harm reduction outreach strategies, but not a lot of additional detail than that.
Any questions from other panelists about that report? And while I've got the mic, I really appreciate the quality assurance that Community Services Consortium and the Confederated of Grand Run are not current grantees. I can't edit the color right now, and so I've just got some language here to correct that. Thank you for the immediate feedback. And thank you, Tatiana. And if you look at the list here, Church at the Park, we've got Kathy and Amy. I know Kathy's here. I'm not sure if Amy has joined us.
All right, I can get it. I was able to review both her scope, her scores and my scores, and we both agreed on a lot of the same stuff on here. So for number 7, Church at the Park does not provide culturally and linguistic specific community. We do work to ensure that language barriers do not impede access to necessary resources. 2 of the positions for this project will be bilingual. We currently have a bilingual case manager at each site for Spanish-speaking participants, and our resource materials are available in both Spanish and English. Additionally, Church at the Park has a contract with Oregon Certified Interpreters Network for providing services to those who speak languages other than Spanish or English. Through these services, Church at the Park can offer interpretation for over 74 languages and dialects, facilitating communication and access for clients from diverse backgrounds.
Kathy, and hi, Amy. And their application is for $1.8 million for peers. Can you give just a couple sentence summary of how the peers will be working?
Amy here.
She's here. She may be away from
Okay.
computer. I asked her to unmute. Maybe that'll alert her.
It looks like a lot of this stuff is integrated together in here, especially in their writing. It took a lot of reading to get to what they were having in here, but they are they utilize their peers for crisis response, and I'm trying to find that detail that I had. My apologies. My eyes are kind of funky today. So they have crisis response. 2 PSS from the crisis response team will be designated for community outreach and partner with someone from the Church of the Park Department of Public Safety and Standards Training certified safety team. They will be available to respond to calls and requests for assistance 7 days a week. So the peer support is really triaging and stabilizing crisis situations, and they go out with mobile crisis teams.
Thanks, Kathy. Any questions about that? Okay, I'm going to move on to Community Services Consort. Keisha.
Sorry, I was just wondering, it seems, I don't know. That's more on the mental health side, and I'm just wondering if another entity is paying for that service, the crisis response, but could be not.
It doesn't specify that. The narrative within the proposed budget does say this: the services and supplies budget includes $1,000 a month for outreach supplies and a 10% inflation increase for subsequent years. They do put in some costs for vehicle maintenance and mileage stuff. And they also have a lease space for an outreach day center.
Okay. Last thing, did they specify a addiction peer or a mental health peer, or they just say peer, like globally?
It just says peer. They have 4 FTE of the peer support specialists, and they have an assistant manager in there as well.
Yeah, because peer support it's either adult addictions or adult mental health, and so they didn't specify which.
It is not specified in here.
Thank you for the clarification. Thank you both. We're going to move on to Community Services Consortium. Dana?
Yeah.
Hi.
Hi, happy to talk about CSC. So their answer to question number 7 for culturally and linguistically responsive services is, as a community action agency, all of our services are designated to support those who are experiencing poverty, which in itself is a specific culture community. In addition, we have culturally specific services for rural populations, veterans, Latina, Latino, Latinx communities, including bilingual and bicultural staff, people with disabilities, the disabled community, LGBTQIA2S+ populations, youth, and other services for BIPOC communities. We understand the intersectional nature of culture and identity and recognize that all of our participants are individuals who hold multiple identities. And let's see, regarding their services for those eligible for Medicaid funded services, we would bill those services to Medicaid instead of Measure 110 funded services. Measure 110 funded services cover things that Medicaid does not, and only a small subset of the population will be eligible for Medicaid funded services. CSC manages multiple funding streams and is skilled at eligibility screening and fund tracking. As part of our screening and enrollment, we will verify eligibility for any billable services to Medicaid and direct those eligible costs there. Their response in regards to peers. So peers, for them, it says they will do ongoing peer counseling and support services. They have special expertise in supported employment, but will also be able to offer broader support as needed. So the peer funds will be used for a point .05 FTE for an operations manager to coordinate services across the program components and provide intensive support on more complex cases, and a 3.3 FTE for employment specialist to provide mobility monitoring, resource navigation, job coaching, career exploration, expungement assistance, and to set up work experience. And then 0.66 FTE would be for a family advisor to provide services both on and off-site, conduct outreach, provide home visits, culturally informed mobility, mentoring, and identification of supportive services. The funds that for peers, they're also asking for funds for transportation support. So this would be to help pay for transportation costs to get to appointments, interviews, employment, etc., as well as funds to help for participants' employment and training supplies. So that would be for fees, identification, work clothes, shoes, tools, and related expenses to support job training and employment. Subsidized employment includes wages for the 2 participants a year. They also have fund requests for housing. And so for their housing, apologies if you can hear my dog. I'm okay. I'm safe. I'm not under attack. So the FTE there is 0.05, and this is for an operations manager to coordinate. Let me read their answer to housing. I think that's important. And it says, applicant will continue to offer transitional and supported housing services for individuals with substance use disorders. They will conduct an assessment of the individual's needs, including housing navigation and rental assistance. They offer individualized community-based placements, including emergency housing, family housing, permanent housing, recovery housing, only if this is desired by the individual, supportive housing, and transitional housing. So the funds are for that 0.05 full-time employee for the operations manager who will coordinate the services across the components of the program, as well as a 0.66 full-time family advisor, which would be the one that does the on-site and off-site outreach to families. And then the residential support includes the rental assistance, utilities, application, and move-in fees related to 30 participants. So that's about $4,000 per participant. Let's see. And then they're also asking for harm reduction funds. It says that they desire to expand services to include harm reduction services. They indicate that they see a need to save lives in the community because it is a large community with rural areas, and they feel that access to harm reduction services would pair well with their street outreach. But then this area is very rural, so this is kind of my stomping ground. So it's kind of, we call it the canyon. And so they said that in practice it would be more like forest outreach, which is very true. This is for the harm reduction. They said for the cost it was for supplies and information for the participants, but they didn't list out what those specific supplies were.
Okay.
And funds for the harm reduction would also be to support that operations manager to coordinate the services, as well as the family advisor to help do those outreach services to the community. And I think that's it.
Yeah, Dana, you nailed it. Thank you. Any questions for Dana? And this was also Amy, if Amy is back and has any feedback or comments for Community Services Consortium. Okay, let's move on to the Confederated Tribes of Grand Ronde. We've got Daniel and Dana's back up. If you could share starting, read question 7 and then move on to the rest of the questions. Thank you.
Sure, I'm happy to do that one as well. So this is their application was really short and sweet and to the point. And so for them, their answer was the tribe was among the first to offer culturally relevant opioid and substance abuse treatment services in the state of Oregon and employs a number of evidence-based programming to support SUD treatment. These include Warrior Down, White Bison, Wellbriety programming, talking circles, traditional medicines and healing, and other AIAN-focused programming. In regards to their Medicaid billable services, their answer was that the tribe will ensure that Measure 110 grant funds are not supplanted through tracking its expenditures on the project separately, and that funds are used strictly within the terms and conditions proposed in the grant contract. Moreover, the tribe will maintain clear records of prior funding and ensure that grant funds are clearly differentiated from any other funding stream that is funding the proposed project. The tribe will guarantee that these funds will supplement the activities proposed in the grant project and are only used in accordance with the grant terms.
Great.
Okay, and for peers, they say peers, it really was not part of their application, and no
Yeah, it
funds
looks like
were requested.
they just applied for SUD.
Yep.
Perfect.
And same with housing, no funds there.
Yep.
No. Okay.
You see
Perfect.
that 4 million on the nose. Dana, you had your hand up. Go ahead.
Yeah. Oh, Dana, you did such a great job. Nothing to add. It's exactly what I have here in my notes.
Awesome. Thank you both. Any questions for Daniel or Dana on Confederated Tribes of Grand Ronde, Community of Oregon? Okay. We're going to move. Oh, sorry. I'm falling off my follow-up here. HIV Alliance is Danielle Cartwright and Daniel Garcia. I'll put you in here and take it away, and then I'll queue up Ideal Option next.
Yeah, this is Daniel. Hold on, I'm trying to manage my screens here. Apologies. For question 7 for them, let's see. I was a little bit more ready 2 seconds ago. Just to read some of the question 7. All services at HIV Alliance are culturally and linguistically responsive, and some are also culturally and linguistic specific. For example, we have an LGBTQ plus peer support services position in Marion County for LGBTQIA2S plus staff that specifically addresses unique barriers to wellness for LGBTQIA plus PWUD people in Marion County. We partner with the Confederated Tribes and Grand Road to provide culture-specific SSP and integrated services for Indigenous Native American community members at Great Circle Recovery. We also provide testing services at Willamette Gender Resource and Advocacy Center, Salem Capital Pride, and LGBTQIA2S plus community events. HIV Alliance currently receives funding from the CDC to provide services specifically to BIPOC PWUD in Oregon. We have staff and offices based in the rural communities that they serve. We also employ many bilingual staff, including several in Marion County to accommodate Spanish-speaking communities, and our staff have access to phone-based language interpretations. We also provide access to ASL interpreters. That is for question 7. Let me go back to this screen. Does applicant indicate services if they're Medicaid available?
Daniel, I can jump in because they don't request SUD. So going into the peer support, I have it up.
Okay.
If you want to look to what the next one is. So for peer support, they say PWUD will receive ongoing peer counseling and support through HIV Alliance's 2 certified peer support services in Marion County. The identified SSP and community referrals, as well as through street outreach and other staff partners engaged directly with houseless communities. They'll tailor outreach to LGBTQIA 2S plus populations, including public sex environments, online dating apps, and community events outreach. So it's both in office and in person.
Great, thank you for that. And housing, kind of housing are they asking for?
It says that they conduct a housing needs assessment, and then based on the assessment, they'll provide housing navigation and supportive services, rent utility, financial assistance, hotel respite, emergency shelter supplies, and housing-related transportation assistance as determined by individual need.
Anybody have any questions about that before we move to harm reduction? At 1.234. All right, take it away.
Okay. Harm reduction. It's pretty long. Services will include overdose reversal training provided at SSP and community events, naloxone access, sterile syringes with safer injection drug use supplies, used syringe collection, sites and community drop boxes, safer smoking supplies, wound care kits, referral to SUD treatment, linkage to in-house peer services, access to drug checking supplies such as test strips, information and education about harm reduction services in the form of one-on-one consultation, educational events, and written materials, rapid testing for HIV, hepatitis C, and syphilis, referral to PrEP navigation, referral to other healthcare services through HIV Alliance and partners, and street outreach / mobile harm reduction services for unhoused populations.
Wonderful, thank you. Danielle, anything you want to add?
No, thank you.
Okay, any questions from anybody? I hope Danielle Cartwright remains off mute because she's up next for ideal option. Okay, let's
Yes.
go ahead.
All right, let me grab that one. All right, so for ideal option, we have their statement is ideal option is committed to coordinating or offering to the best of our ability culturally and linguistically specific services in response to the preference or request of service user. This includes translator capabilities or care coordination with other culturally specific providers if needed. It is also ideal option's responsibility to develop continuing education for staff to be sensitive and responsive to diverse cultural needs. Ideal option ensures culturally responsive services by providing a welcoming and respectful space for diverse service users to express their unique needs. All linguistic and translation barriers are addressed by providing verbal translation to individuals of any linguistic or cultural background. Ideal option creates and uses interventions that are patient-centered. Ideal option engages in continual quality improvement by maintaining open lines of feedback from the population served. All linguistic and translation barriers are addressed by providing verbal translation to individuals. Ideal option ensures the well-being of our workforce, providing livable compensation and holistic healthcare for all staff. Through these and other acts, we'll develop and maintain capacity to deliver culturally and linguistically responsive services as required by our M110 grant agreement and law. This policy applies to all programs and staff employed at Ideal Option without exception. This includes staff and clinics outside of the state of Oregon.
Fantastic. And it's clear ideal option just applied for SUD at $2.688 million. And we know that everybody is saying, we're not going to bill Medicaid. Is there anything else you wanted to add about SUD in terms of what kind of services, or is it just for uninsured or underinsured Oregonians in Marion County? Anything to add?
So they said all services proposed in this application are to cover services not covered by insurance. And they list for underinsured treatment, jail treatment, and peer outreach specialists specifically.
Okay, and we know that Medicaid does not cover folks who are previously covered by Medicaid in carceral settings. Any questions for Danielle on Iron Tribe? I'm sorry, ideal option? I'm ahead of myself. Great. Kylie, You are the sole reviewer who's present today on Iron Tribe. Welcome back.
I'm ready.
Hit it.
Okie dokie. So 7, um, they're providing culturally and linguistically specific services to a diverse range of communities. Our programs and services are centered around trauma-informed care as we serve populations that have experienced trauma associated with substance abuse, mental illness, childhood abuse and neglect, intimate partner violence, IPV, sexual violence, child welfare involvement, justice system involvement, incarceration, discrimination, and oppression. We employ multiple bilingual and bicultural staff who provide culturally specific support services such as translation and resource navigation. We ensure that our materials are available in Spanish as well as English. All of our houses are open to undocumented individuals and families. ITN has experience serving individuals with both physical and intellectual disabilities. In our burn homes alone, we have made several accommodations for clients with physical disabilities such as congestive heart failure, muscular skeletal disorders, and intellectual disabilities such as ADHD, ASD, and cognitive delays, as well as mental health disabilities such as schizophrenia, OCD, and bipolar disorder. All ITN housing is gender inclusive and can reduce a significant barrier for trans and gender nonconforming individuals. We maintain relationships with community partners in each county who provide gender affirming care and LGBTQSIA plus specific services, so we know where to refer clients who have needs that our organization does not directly provide. All staff members are trained on providing affirming and inclusive care to trans and gender nonconforming individuals, as well as members of the LGBTQSIA plus community. ITN is family-focused organization, so we have extensive experience providing services for parents and non-traditional parents with minor children, as well as pregnant persons. Our houses are set up to accommodate individuals and couples with children. Our burn houses have served many diverse types of families, including single mothers and fathers with children ages 0 to 17, co-parenting parents with children, pregnant persons, both with and without older children, and parents in the process of reunifying with their children from ODHS custody. Now, they only are requesting peer support and housing, and the way that they describe this is that they are previous burn members in Marion County, and so they have already established housing in beds within this. So this would be a continuation and an expansion. They plan to continue operating the first house at 45th Place, which was purchased with the Measure 110 funding. It's a 6-bedroom home where participants actively work with peers, and it's a 6-month-long stay with the goal of entering and maintaining sobriety. Program is at no cost to participants, and they identify that they fill in the gap of where Medicaid cannot cover. They say that there is rent costs for them, so they want to cover that in the request, taking our ability to help 10 to 17 people to an expected 24 to 28 individuals or families annually. And the way that their peer supports interact with that is that the activities for peer services will focus on helping residents with basic and immediate needs like getting IDs, food stamps, finding recovery meetings, getting to appointments at treatment or drug court or child visits, learning money management by starting savings accounts, food shopping, cooking for the house meal, and applying for housing. And within their budget, you can see that their line items include a resident manager at 1 FTE, peer support at 1 FTE, facility staff, program director, those are part FTEs, as well as some partial for executive director, office manager at 0.07. And then there's some overhead of administration. So it is the peers are actively supporting the housing structure.
Great. Thank you, Kylie. It's a great report. Any questions? Okay. Put in the chat, Ariana, you are the sole reviewer for Marion County Health and Human Services, the CMHP for the community in Marion County. Will you take us away?
Let's go. Let's see. Their response to question 7 is MCHHS serves all individuals with SUD, providing culturally and linguistically specific services. Our bilingual and bicultural staff enable us to meet the needs of the Latinx population, while our trauma-informed inclusive services address the diverse needs of other marginalized groups. Our experience includes services to individuals with intellectual and developmental disabilities, youth-friendly services, and support for parents or non-traditional families. We continuously seek feedback to identify gaps and improve service delivery. For SUD, they offer SUD services to individuals who are eligible for Medicaid and other health insurance reimbursement. They're an existing Burn Grant recipient. They also provide services to individuals who do not have access to these resources. They submit claims for reimbursement from all eligible payers and other commercial insurances. They say that Measure 110 funding would allow them to expand their range of services. They've used previous grant funds to develop new services, which we're not previously offering. But yes, they are Medicaid billable, and I think they're just seeking this funding to expand services into areas that are not for peers. And they call them mentors, which is interesting. They want quite a bit of money for training. And it looks like their peers are they really just want to hire new staff and expand the number of peers that they have. It's a little vague. I think they're all office-based, the peers.
Okay, and that's the $5.7 million.
Yes, yeah.
And then Ariana, their program costs are 4.6. The total ask is over $15 million, which eats up the vast majority of the county funding. Can you just give a couple of quick bullets about what you're seeing in the program cost?
Sure. Because yes, it is really, really high. So the program costs their lease and their EHR, they want $62,000 a year for an EHR license. And their lease costs per year $247,827.50. So that I'm not exactly sure why it is that we would need to cover a county health's lease. That was a kind of a red flag for me as a reviewer. And they have supervisory and program staff in there, 0.5 program manager, 1 FTE clinical supervisor, program coordinator, and 2 behavioral health aides. So that's a lot. It is a lot in the program costs.
Great. Not great, but thank you for sharing. Are there any questions for Ariana on Marion County? And for a time check, we're at almost 1 hour in, and I would like to agitate us along a little bit farther. We need the Measure 110 team to lean in for the Mid-Willamette Valley Community Action Agency. Neither of the reviewer recommended funding any of these service areas, so it would be nice to hear from the team on what you're seeing and for starting to read question 7, please, and thank you. Ariana, are you opening that up? Is that Kylie?
I've opened up the project scope and at least what I believe is the project scope, because it's sure not answering any of the questions that we needed.
I've got a scoring sheet up, if that's helpful, for is it Evelyn? Evelyn? If somebody wants to pull up the other one.
I have Drew's pulled up.
So it was the application content that seems to have been the point of confusion here. The no answers are different, but it says application was poorly written. I had a hard time finding the answer to the question because they were not answered in order. It was not clear to me how Medicaid is not providing funds to these organizations to pay for these services yet. The other responses discuss say, I've had a hard time finding the answer to these questions because they were not in order. And so that is what the main thread is that unable to really reflect on the content and what is Medicaid covering or not covering.
It's the same from the other reviewer. Answer not clearly stated, and it's spread throughout. And that was concerning question 7 and what they replied on question 7.
So we see that the average reviewer score is 18.5, which is on the lower side of what we're seeing in general. I'm curious, oh, excuse me, I think it's Kylie who's got the budget open. Can you give a couple of highlights about the SUD peers housing and harm reduction, just to get a sense of what the ask is for? I know this county is way over, but I want to make sure we're having presentation for each of our applicants.
Yeah, I'm getting into it. So it looks like a clinic in terms of the program costs, at 1.6. It looks like there's a clinical supervisor at 154. Over the course of the time, there's benefits, there's salary, there's a training and compliance coordinator, 1 FTE, 5 FTE peer support specialists and CRM, and benefits according, with all these FTEs, 5 FTE clinicians and benefits, 1 supportive service coordinator and benefits. There's a National Association of Peer Supporters annual conference, Association of Addiction Professionals annual conference in the training components, a mobile van acquisition and refit for 100,000. There's technology and communications, fuel and maintenance for said vehicle. And then so the SUD has the 5 FTE clinicians, and they also put those conferences that I was just talking about under the SUD area for training. And as well as the peer conference under the peer support. They have their supportive service coordinator housed in the peer area. And they indicate that this peer role will bridge the gap between housing and peer support. Housing. It's not giving, it's kind of the same information from the peer side. And their harm reduction talks about the 5 FTE peer support specialists and CRMs. And I'm trying to look at the details of their harm reduction. I don't know if anybody else is seeing any more. I don't see the particulars.
Around naloxone or wound care or hygiene kits or anything. It sounds like an offering of some staff, but to do service to do work in a bunch of different service areas. Maybe they're splitting it up along that way. Let's do this. Are there any questions from the panelists for Kylie or Kathy who are not the reviewers, but just pulling up the information to try to reflect what it is? So if not, I'm going to move us on. Okay. Hearing none, I'm going to move on to, page 2. And you'll see in the chat, we've got Painted Horse next, but both of those reviewers are also absent. So we've got the reviewer score of 22 average, and 1 of 2 reviewers recommended its peer supports for $4 million with some program costs. Kylie or Ariana, you're unmuted. Are you going to pick up this one?
I'm sorry, I'm multitasking, but I can pick it up.
Okay,
I do have the project scope open if you want me to read it.
That would be great. Thanks,
Yes, please,
Jason. I just saw Ariana unmuted, and that's why I went to it.
So the answer for number 7, yes, Painted Horse Recovery provides culturally and linguistically specific services to the urban Native American population. We lead with culture, and we also have linguistic services in our meetings held at PHR. At our previously funded Multnomah County M110 location, we offer sweat lodge, drumming, beading, and take clients to ceremonies to connect with culture.
Great. Can you share the peer supports, a bit about their scope of work?
Just one moment. Let's see. So they say they will, sorry, my screen is, okay, there we go. They will build a peer-run recovery center with grant funds. Oh, that's concerning, actually. We're not supposed to be building centers with grant funds. So that is a flag for me just reading that. But then with previous funding in Multnomah County, let's see, their peers. So the question is, what are their peers? Focus on recovery, capital, emphasis on Native culture, resource navigation, outreach and engagement, recovery capital development, Narcan education, estimated 50 clients a month. Sorry. There's quite a bit here. I'm just trying to pull out what's relevant to the peer support. So it does look like it's integrated with their SUD work from what it's saying.
Okay.
But I do, like I said, that one sentence is a little concerning, that they said they will be building a recovery center.
Yeah, we don't allow capital costs. Maybe that's why one of the 2 reviewers did not recommend it. I'm making a guess because neither are here today. Any questions about the Painted Horse application that Jason can look up for you? Thanks, Jason. Okay, hearing none. Measure 110 team, you're up again. Pathfinders. They are an existing grantee. Their reviewer average is 27. Both reviewers recommended funding their ask at 1.6 for peer support services. Could someone share a bit more about peer supports and how they're integrated into the rest of Pathfinder's work?
For Pathfinders, for number 7, recognizing that communities of color are overrepresented in the criminal justice system, we prioritize culturally and linguistically responsive services and staffing informed by principles of diversity, equity, and inclusion, justice, and belonging. A representative number of our direct care staff are from communities of color and have lived experiences similar to those we serve. We have bilingual, culturally responsive, and gender responsive peer positions, staff in each of our peer support programs, and across the agency provide services in Spanish. We have translated our market materials and program documents into Spanish to improve access. We use Linguava, a virtual interpretation service that enhances accessibility when communicating with our participants and their families. Linguava offers a comprehensive range of services, including telephone, video, and American Sign Language translation, covering over 230 languages. We have enhanced our outreach strategies and are conducting targeted outreach to communities most impacted by the criminalization of addiction, intergenerational trauma, and historical lack of access to services, with a specific focus on Latinx, Black, African American, and Indigenous communities. This includes providing information at applicable community provider meetings and tabling at community events specific to these communities. By focusing on our services on those who are involved in the justice system, we will be able to target more participants who are impacted by the criminalization of addiction and who are in need of support and services now. The services increased the likelihood of successful outcomes for these groups, easing the burden of criminalization, intergenerational trauma, and a historic lack of access to service.
Thank you so much, Kathy. And their request for peers. Perhaps a quick answer might be in their budget. And I'll let Greta know that you're up for Soaring Heights in 4D next after Kathy finishes.
They have a Resilience and Recovery Project peer support program that walks alongside justice system impacted individuals with substance use issues to build individual, social, and community resources that promote long-term resilience and recovery, successful completion of legal requirements and/or community supervision, when applicable, reintegration into the community. Peer support specialists with lived experience with addiction and criminal justice system engage participants in a goal-oriented collaborative relationship to provide personalized support through this holistic and responsive individual and group peer support services.
Awesome, Kathy. Thank you. Any questions about Pathfinders? Okay, Greta, take the reins for Soaring Heights in 4D, please.
Okay, I'm ready. So answer to question 7 for Soaring Heights. Our service area is Marion County. All the individuals and families we assist are low income and about 50% are homeless. They are diverse in race, religion, culture, and sexual orientation. We had a deaf individual in our home, and volunteers speak the languages of our Hispanic, Russian, deaf, and Native American communities. Oftentimes, we house individuals that are of Native American descent. To be more culturally responsive and ensure their needs are met, we work closely with the Confederate Tribes of Grand Ronde. We have received a grant award through their Spirit Mountain Community Fund and Great Circle Recovery. We offer continued education with an emphasis on culturally specific needs. Our traditional health workers and community health workers are trained and certified through Pacific Source. Our staff is also certified as certified recovery mentors. They also receive DEI education and are trauma informed. Our founders have lived experience, and many of our graduates return to volunteer. So they're asking for peer support and housing. So I'm going to read to you because they did a very good job of laying out their description of how they would use their funds and the funding that they asked. So I'm just going to read what they plan to do with it. For service area of program, the activities are paying for one FTE executive director, one FTE administrative assistant, office space, office supplies, and a vehicle each year for outreach purposes. Year one, the cost is $307,511.60. Year two is $3,2,754.20. Year three cost is $49,940.90, and year four is the cost of $367,217.40. So it kind of goes up a little bit each year. Soaring Heights has reached the point where their full-time executive director and administrative assistants make sense. We have outgrown our home office, and need a space away from our residents to conduct business. A vehicle is necessary to our outreach strategy to send peer support personnel outside our walls to meet the community where they are at first contact, those who are waiting for a bed, graduates from our program, or who are referred by a partner organization. We want to be able to reach people in crisis quickly and professionally. For the service areas of peer support, the activities are paying for 5 FTE certified recovery mentors and their annual continuing education. Then they lay out the cost. I'm not going to read them all, but they do go up each year in that area. And then for housing, the activities are paying for the Falcon House for men's lease and covering the expenses of residents just entering our program before they are able to secure a job. And that's cost is $31,020 for each of the 4 years. And they expect to house 22 individuals per year with the grant. Anything else?
That's beautiful. Any questions or comments? Okay, let's roll over to the fourth dimension.
Okay, fourth dimension's response to question number 7. 4D believes adolescents and young adults fit the definition of culturally and linguistically specific services. As such, it has developed an age-specific peer best practice manual that supports adolescents with tailored programming. So within this application, 4D is asking for just a minute. They're asking to develop a one young adult recovery center and one outreach team to implement the efforts of the Measure 110 grant. And let me just move over to their thing. So their peer delivered service request is a really funding that outreach team and a lot of services and supplies for the occupancy and different things needed to run a recovery center. I can go in greater detail if you want to know that, but they all seemed logical. And then the harm reduction is just to buy harm reduction supplies like Narcan, HIV tests, STI tests, and syringes.
And did you recommend funding? Because I see one person recommended and the other did not.
I did recommend funding if funding allowed.
Okay. And we don't have the other reviewer here to ask more about that. Are there any questions for Greta or from the Measure 110 team who could pull up the other one about this application? A new applicant? Okay. Thank you, Greta. I appreciate it. We have 2 left. Mid-Valley IPA is June, and Youth Era is John McElveen and Ariana. So June, take it away.
Okay, the answer number 7 as WVA or VP peer support programs provide culturally and linguistically responsive services for several populations through employed bilingual peer staff, including Latino, Latina, American Indian, Alaska Native, Black, and African American, and white. The WVP peer programs were designed with specific care elements to support the unique needs of these cultural communities. WVP supports all community members with culturally and linguistically responsive services, irrespective of their race or ethnicity, through the use of bilingual staff and qualified certified healthcare interpreters. So they applied for peer support and harm reduction. Their peer support is out. It's office based, but also out in the community. I do want to say that their budget was not, I don't believe, was done correctly. So if you see their program costs, that is a majority of their peer staff wages. They also have in their program costs vehicle lease expenses and gasoline, insurance, and also their a portion of their electronic health record system. They do state that they do have the ability to bill, but these services that they're planning to provide are not billable through Medicaid. Their harm reduction program, they plan to provide full spectrum services, safe use supplies, Narcan. They did not add any line items, though, for supplies. So that was a little confusing. I'm just not sure if they struggled with this budget. Did I answer all the questions?
You did, June.
Oh, my
Thank
goodness.
you.
Okay.
Love it. Any questions for June? Okay, last but not least, in Marion County, we have Youth Era. Thank you, John and Ariana.
Youth Era, they are, as you can tell by their name, they are focused on youth.
And Ariana, you're about to be totally pulled into screen sharing and mathing and all of the things. John, do you mind giving Ariana a moment of respite before she dives into that and reading number 7 and telling us about their peer support? That'd be awesome. Thank you.
Yeah, absolutely. Hold on, I've just brought it up. Oh, the culturally and linguistically specific services? Or just talk to you there in general?
Sorry, I'm nodding. I'm not speaking. Yes, please fully read question 7 and then describe their peer support budget.
Sure, absolutely. While Youth Era does not exclusively serve a single cultural or linguistic community, we're committed to ensuring that our services meet the needs of diverse youth populations, including BIPOC youth and those whose first language is not English. To achieve this, we prioritize hiring multilingual YPSS, youth peer support specialists, from a wide variety of cultural backgrounds, ensuring that youth can access support from providers who share their identities, experiences, and linguistic abilities. If we are unable to offer a culturally or linguistically appropriate match from within our staff, collaborate with community partners to facilitate connections to culturally specific resources. Through these partnerships, we ensure that every youth, regardless of their background or language, receives recovery support that is accessible, inclusive, and culturally responsive. In terms of the proposed activity scope of work for their peer support specialists as part of their budget is hiring, training, and onboarding 2 full-time recovery peer support youth, I assume, peer support specialists to build and deliver new recovery services in the county within 3 months. The activities are both, I guess, in the context we were talking before, in-house and out in the community. Weekly youth-driven support groups, one-on-one peer support sessions, also internally resource navigation, connecting folks, youth, with healthcare, housing, employment, and culturally specific support, to touch on the last section, as well as community outreach. Monthly outreach activities planned, partnerships with other institutions, schools, providers, and related organizations to identify, refer, and receive referrals for youth. The other there's also supervision that they note, maintaining a peer supervisor, and they delineate the amounts of youth they want to serve in year 1, year 2, 3, 4. So around 1,400 total over 4 years, starting with 450 in year 1. And the other identified activities are providing harm reduction tools, and basic needs and resources. I need to check, Ariana, well, maybe that was June. I'm sorry. There's a lot going on here today. I don't know about their budget. No, they budget for the for harm reduction services. Looks like about 20,000. Looks like somewhere around 20,000 annually for Narcan. That looks to be the specific harm reduction intervention.
Looks like they go ahead, Ariana. Sorry.
If I can just add, they do quite a bit of street outreach, and their peers are, and so part of that is handing out Narcan, but that's not their focus as much as the peer support is, which is probably why they didn't apply for harm reduction as a category.
Right. I was going to add that. Thanks. Thanks, Ariana. I am a bit confused. I don't think this is a major thing. I note that they mention that. Oh, okay. I see. I know. I noticed this when I did that. They're just including program supplies as part of they're folding in, if that makes sense, naloxone into their program supplies, as opposed to putting it as a separate line item and then asking for a separate harm reduction allocation.
Right. They built it all into what it takes to have peers. Yep.
Exactly.
That makes sense. And we know that folks are handling the budget workbook in different ways. Thank you, John. Appreciate it.
No
All right.
problem.
Any questions about Euthira? Great. I know that was a lot. This is not our biggest county, so thank you for leaning in so well and helping us report through. I'm going to move us forward, and thank you in advance to Ariana for your magic helping us launch into the discussion. So you saw that there were many service areas that were recommended by 1 or 0 reviewers, but even taking the recommendation service areas that are both saying, yes, please fund, we're still more than double than the formula for Marion County. Love that yellow reminder on the top right. That's our max, is 28.7. So this is potential burn number 1, just to start us into conversation. And it looks like Ariana was able to get all of the providers onto one screen, which I really appreciate. We did need to correct that CSC and Grand Ronde are not current grantees, so those should not be orange, but I'm struggling with live editing. I don't want to mess anything up. And what this is a $4 million cap. So if you recall back on the formula, each community starts with a base. Small, medium, large, and extra large are different quantities. This is a large county, and the $4 million cap would basically be saying, so sorry, all applicants, we're only going to give you $4 million max because there's not enough money to go around. And then only funding when 2 reviewers recommended moving forward. Ariana, anything else you want to add? Am I summarizing your work accurately?
You are. Yes, you are. And I apologize for the inclusion of CSC and Confederated Tribes as previously funded. I think that was a PASTO. One thing I did want to mention is that the OAC has said that they want to prioritize previously funded areas. And I want to note that in Bridgeway, harm reduction was not previously funded for them, and they're asked. That's a new ask. I do have, if you'd like me to screen share my spreadsheet, I do have some updates to these formulas that I can share.
Okay, let me get through the deck just to kind of put all the data in the space, and then I'll call on June. So this is the $4 million cap with only the previously funded, but I think you're probably working on the edits here. And I will note that the OAC, their top priority are existing grantees and grantees who are culturally specific and really clearly culturally specific. So if there are new applicants, we're able to demonstrate that competence they wanted to ensure those folks are included. So I'm going to call on June and stop sharing and hand the reins over to Ariana. June, oh, your hand's down. Do you have?
Can we go back to the slide where you had all the caps, like all the organization, that first one? I just wanted to look at it.
Sure
Sorry.
thing. No problem. Going backwards. I hope yes. Here we go. So to this one.
Yes. I think that, I think that if we were to fund Boulder Care, we shouldn't probably be funding them for harm reduction. They're not offering a full spectrum in the community service where others are. So.
And I thank you for that input. And I'm also hearing in these conversations that in more rural areas and frontier areas of our state that it's an asset, but understanding this is not a perfect exercise because there's simply not enough funds to go around, and all of the decisions are hard. Ariana, the reins are yours. And while you're prepping, Keisha's hand is up. Go ahead, Keisha.
Yeah, I'm wondering if we can kind of who might be the CMHP or can build Medicaid, because I was looking and kind of Painted Horse. I think they're asked for something around 4 million, but in this formula they get 261,000, and I don't know what they can do with that.
So thanks, Keisha. I'll flag right here that row 16, Marion County Health and Human Services is the CMHP. They're an existing grantee. They're part of the burn in Marion County, and they applied for $15.5 million.
I think you may be looking at Painted Horse right below them, which gets is asking for 261,000 for program costs. I could be very wrong about that. So I'm just putting a little asterisk mark in front of Marion County to indicate that they are the CMHP. So this first is everyone is funded. And
I was looking at, I'm sorry, Painted Horse had asked for 4 million, and it looks like they got 261,000, and I'm just wondering what can be done from the ask to that.
This is program costs right here. So their total ask is 4,299,000.
Right, and on one of the sheets, I seen that was all that they got was 261. On one of the formula sheets.
Yeah, that's because that was just taking a look at including only the service areas for applicants where the reviewers both endorsed funding. And looking at Painted Horse looks like one of the two reviewers. But we are, doing this new process here, not new process, but looking at this together with everything still on the table.
Yes, so this is everything still on the table with even if only one reviewer approved it. And this is just for the OAC basically to see all of their choices because y'all are the deciders. So this is with everyone funded. We're actually $41 million over, and of course that can't happen.
Ariana, can I jump in for just a quick second?
Sure.
It looks like is Mid-Willamette Valley Community Action Agency removed because no reviewer recommended them? They were the ones that were all orange. I just want to make sure that they have been removed. Okay, so we're not saying this is everybody. This is everybody who got at least one endorsement.
Yes, yeah.
Great, thank you. Go ahead.
Okay, and then in the second, I'm just gonna, in this second scenario, these are the folks who were previously funded: Bridgeway HIV Alliance, Ideal Option, Iron Tribe, Marion County HHS, and Pathfinders. And with that, we have 21 million previously funded and 7 million extra. And that, I will note, does not include a cap of 4 million. So it's even more than that we have available for other entities when we apply the $4 million cap. And then
Ariana, those numbers are not the organization full asks. Can you describe what reductions you included?
yes, I see what you mean. So I did do some reductions on Marion County Health and Human Services just to bring them down into the ballpark of what everybody else might have been asking for. And so there is a $2 million cap that's in here on select areas. And actually, I kind of recommend that you ignore this one. This is me just noodling around, which I shouldn't be doing necessarily. So let me draw your attention to this proposal right here, because what you will see is that although these asks have been removed because there was only one reviewer, right? Everybody else's asks are exactly as they are represented. However, I have included a $4 million cap on the side here. So this is the actual number. And assuming that Painted Horse doesn't get funded, I did put in a 0 for them over here. And the only reason I would assume that is because their only area they're asking for is peer support, and it had one reviewer saying yes. Happy to add them back in if needed. But that brings us down to 34,753,000, which is 6 million over. So perhaps a suggestion would be to pass all of this scenario 3 over to the OAC for further discussion. That's just a suggestion. Or we could discuss more and get closer to that amount there.
So June's hand is up, and Kathy did note that Boulder Care was also removed from this table.
Yes. Yeah, they are.
And because Painted Horse Recovery is explicitly a culturally specific organization, I would assert that the OAC would like to see it in there.
Yes.
I mean, I'm not a member of the OAC. Keisha is, Morgan's here. Y'all, if you want, Amy's here. If y'all want to have that in there, this is a great time to help us inform. And June, please go ahead.
Yeah, I was just going to say, I just had a couple of things. I agree. I think Painted Horse should be included in this, but Jason had mentioned that they had a capital expense in their budget, and I just wonder if they're not able to do capital, would that hinder their ability to provide the services that they want to provide for this county?
That's a great question, and we don't know because we can't go talk to them. But we can move them forward and then pick it up in negotiations. If they're offered a smaller amount, kind of what that would look like for them in Marion County and what sorts of services they might be able to offer.
And I will say, just looking more at their budget. So I was reading from their project scope where it said directly that there was going to be a center built from recovery or from grant funds, but in their budget, I don't see where that's represented. So I'm a little confused what that meant now. And I didn't review this application to begin with. So I just was reading what was in their project scope. But like I said, I don't see line items in the budget that actually talk about purchasing a building. So there is some confusion there on my part.
I guess if it's not in the budget, it's not happening. So that's good.
Any other thoughts on what to pass forward? How does this look?
So to summarize for folks, it includes everybody except Boulder Care and Mid-Willamette Valley Community Action Agency, which sounds like the application was pretty confusing and hard to really discern what the ask was. And then that would get the total to about 13 million over the formula. Keisha?
Yeah, I'm wondering if we could, I know the cap is 4 million, but if we can come down on the cap more, I think it would bring our bring it down. Like, do we have to go at the 4 or can we go with 3 million?
Do whatever you want. It's you know, again, we're going back to thinning the soup and
Yeah.
how thin it gets. And so it's either fewer providers with thicker soup or thinner soup and more providers. So thanks for thinking of that, Keisha. That's an option. Morgan, you're up.
I think it's just really hard in some of these really large counties because the cost of doing business can be higher, the amount of people that they're serving is higher. So, the $4 million cap here probably makes sense, I would think, if in counties far less than half the size we were using $3 million caps. So
I'm going to go ahead and ask a hard question, which is based on what you heard today, are there any organizations that we should consider not funding? And because thinking about the OAC's priorities, that would be new applicants that are not asserting they are culturally specific. That is where we would want to start if you want to engage in that conversation.
Yeah, I would like to see where we get to.
Which organizations, Keisha, do you recall?
Yeah.
We've got so we've got Keisha, Morgan, and June with your hands up. Does anybody have a suggestion for us to look at? Removing, which is heartbreaking, but reality.
I do.
Yeah, hit it.
I mean, don't shoot me, but Church at the Park, I would remove them.
And say more.
Well, and maybe it's not this organization, but I didn't feel like they were super culturally responsive.
And maybe if somebody could read 7 for that again.
Yeah. Oh, Kathy, you look like you're queued up. Are you?
Yeah, Church at the
Awesome.
Park does not provide culturally and linguistically specific services to one specific community. We do work to ensure that language barriers do not impede access to necessary resources. 2 of the positions for this project will be bilingual. We currently have a bilingual case manager at each site for Spanish-speaking participants, and our resource materials are available in both Spanish and English. Additionally, Church at the Park has a contract with the Oregon Certified Interpreters Network for providing services to those who speak languages other than Spanish or English. That allows them interpretation up to 74 different languages and dialects.
Thank you, Kathy, for reading that. And thank you, June, for the suggestion. Any feedback or questions or conversation about that suggestion?
Well, they sound culturally specific to me. I mean, they're for the Latinx population.
Shall I put them back in or leave them out?
I would leave them out.
I think a lot of their specificity in their, they didn't really indicate if their peer people were mental health or substance use on that. And they work with triaging people in crisis. I think that was what Keisha had talked about before. when we first introduced them. So they're part of the crisis team. That's what their peer services are doing.
Okay.
We got 2 take them outs, 1 leave them in. June?
I also have a suggestion here. There's a few organizations on here I think that could be taken down in their ask more. Marion County Health and Human Services can probably be taken down more. They're the CMHP. Just a suggestion. Some of these organizations do have the ability to bill for a lot of these services. I would say specifically for Marion County, just a suggestion, taking them down in assessments by half. Those are a billable service. And some of the SUD services too, for some of these other organizations that are able to bill. Just a suggestion here.
And it really goes with if we're going with the cap on the totals, because if we go with the cap, then that takes them down 50%.
Who?
The Marion County one, because I mean, if you look at what they have in peer support and SUD and their program cost, but we're only, where her cursor's at, we only allow them the 4 million.
Oh, I see what you mean. I'm sorry. I was looking at the.
No, you're fine.
You are right. So they've already been taken down by a lot because they asked for a large amount of money, like a huge amount of money.
Yeah, 15 million was their ask.
Yeah, so they're asking for more than half of the cap for the entire county.
Yep.
Yeah, my apologies. I was looking at the individual service area amounts. I apologize.
Yeah. Yeah, and the OAC has asked that when we reduce a budget, that we allow the organization to determine the best way to integrate that into continuing to fund the service areas, but what that looks like for them. Liz?
I'm wondering if we should consider maybe taking a hard look at the SUD and peer support categories, because that's where like a big bulk of the ask is, and thinking about like, it looks like we have quite a few existing SUD providers, and instead of just like cutting them all down, maybe taking out allied health services. And then taking another look at Soaring Heights and WVP Health Authority a little bit closer.
This is where when we have that cap on that total, that what that does is, as Abby had said, it allows the entity itself come in and make their adjustments accordingly. So like if you look at Allied and we cap them at a $4 million for their total, they're going to take that $4 million and say, okay, I need to figure out how am I going to do this for SUD and harm reduction. And we allow the entity itself make those decisions. So we're already cutting them down on that. And I guess it really, we could look at it individually if we're going to not do a cap on the total.
Yeah, I guess what I'm saying is even with the cap, it looks like some organizations are going to need to get cut. I don't think we've already cut some of these organizations in half, and we still like can't get there. And so I don't know that if we keep cutting them down, if that's the best way to go. Like, I think this is a case where like we need to start proposing cutting organizations, so some of the newer ones.
Yisha?
Yeah, I was agreeing with Ariana. We do have a lot of providers in SUD. So probably, eliminating some of these organizations is gonna have to happen, the newer ones. Because it's just not enough to go around. Now, if we only had like 1 or 2 providers, that would be different, but we have a variety of providers in SUD and in peer support. So I kind of agree with Ariana, like now moving to maybe eliminate some of these orgs.
Yeah, it's heartbreaking, but
instead of cutting more and more,
right.
Just eliminating some.
Right. Okay, so I'm wondering if Nicole and Amy have suggestions of entities that we might need to remove from this county, where Nicole is first, then Amy's next.
Could I present one alternative method?
You can try.
Possibly, which would be, I think, well, I guess I'm an opposite school of thought. I think a diverse variety of providers would be more beneficial. And what if we only cut everyone's SUD and peer support categories by X percentage? Because as you can see at the bottom, those are around 20,000 each. So those are the biggest spending categories. So what if we cut things in those categories by X percentage, and that is figured out during negotiation? Or the orgs can move their money however they want around during negotiation.
Amy?
I'm sorry.
Well, I'm looking at the peer support asks, and the one that I see, Marion County Health and Human Services, are they the QMHP? I'm sorry, they probably already said that, right?
Yes, they are.
Okay. 5,788,000, or is that, yeah, $788,153. It's extremely high ask for peer support for a QMHP that can bill for services. They can bill for those things. And I know that we can bill for some of the peer services. So that could be possibly potentially a lower, one to lower.
So I want to jump in here and have Ariana highlight the totals in J 69 through 85 so folks can see. So for example, with that CMHP row 77 Marion County, yes, their peer support ask was 5.7, but we've already brought their total award down to $3 million.
Okay, sorry.
Screening
Sorry. I
Nope.
missed that part.
No, don't worry about it. I just want to it's hard to do this as a group together. It's like, let's wordsmith as a team. Thank you, Amy.
I mean, I think if we're looking at like cutting some of these, the startups, or people that are trying to expand, if we look at their housing, if they're already doing housing, and we looked at harm reduction too, right? We looked at what are they doing for harm reduction. A lot of the Narcan stuff, they had those programs where Narcan was given out free or at a reduced cost to these agencies to give away to the people, or they just mail them. So, I mean, there's some stuff that has to be done. I don't know. I'm just trying to if we look at all the peer support that's offered in this county by each person in orange, right? Those are the ones that are, we could eliminate the other ones.
Okay.
The ones in white for the peer support. And that should bring it down quite a bit.
Except we've already discussed wanting to include Painted Horse. So
okay, so leave Painted Horse.
Great.
Leave Painted Horse.
So I'm gonna go ahead. We've got 3 hands up. I want to get folks' voice, and I would love to try to close at noon with the decision. Keisha?
Yeah, I was just gonna revert people's attention back to we don't look at the categories because we already set a cap at the end. So now we have to just move to eliminating organizations because we can't really cut anymore. Now we just need to work on who we're gonna eliminate to get to the total.
Maybe Michelle has a suggestion, and then after Michelle is Morgan.
My suggestion was aligned with whoever wanted to, I can't remember who it was that mentioned taking kind of being equitable about this and having them maybe rework their budgets, when it's negotiation time. When it's a billable service assessment, treatment, peer, if it's a billable peer service, I believe those should be reduced.
Morgan?
How much are we over right now? It's 32 million here.
Yeah, 3.2 million. And I wanted to point out that if we eliminate one of the entities that is at a 3 million cap, that gets us very close to the goal.
Well, let's eliminate allied health, and I mean, that's all billable services already. I don't think we're eliminating them just because we eliminate them from our sheet, and then we're at the cap.
How do folks feel about that suggestion?
Yeah. And also remembering that we were really only opening it up for new entities if that service wasn't being provided in that county. Like if it's something that's not being provided, not everyone who applies, but if that service isn't being provided.
Okay, so what John and Michelle have to say here.
Yep. Michelle and then John.
No, I just didn't lower my hand from last time. I'll lower it now.
Sail hand. John, go ahead.
Thanks, Abby. Okay, there I am. The Zoom delay. Just a quick point. I'm not going to vote for or against, Allied, but I did review them, and I do know, in full disclosure, I'm the primary regulator of their facilities. Just for full disclosure, it is the only opioid treatment program in Washington County. And also, their request.
John, I just want to make sure you're not bringing in information outside of what you reviewed in the application. That's been the direction by DOJ.
Right. Well, it's a public meeting. I mean, I'm making a disclosure.
Okay.
Yes, that was and I'm done now.
Oh, because
what
you
I
have
was
a
going to
conflict.
say, what I was
Got
going
it.
to, well, I don't necessarily think it's a conflict. It's not a real conflict. It could be, so that's why I bring it out, because
got
it's a
some
public
intimacy.
meeting.
Understood.
Right? Great.
Yep.
I'm going to mention stuff that's in the application because some people have said stuff that it's billable services. There's no question that the services that they deliver are billable. They're fully Medicaid enrolled, have been for some time. Their request is not for that, though. Their request is for using those funds to do services for underinsured or uninsured folks. That could include things like undocumented folks and the like. I'm not saying that number is or isn't. I don't have enough information to determine whether or not that's realistic. I also, there are other funding sources for that, and I hope that's not bringing something extra in, but that's more full disclosure for the process. If we're talking about allocating funds, so in a public forum. So I just wanted to make that point. The other thing too is that naloxone is actually billable if they're a client of a particular facility. So I just wanted to make that clear for whoever's making the final decision. Thanks.
Great. Awesome. Thanks, John. So we've got the 3 million cap model is what folks are in discussion about. Any other comments or suggestions or concerns before or a motion?
We're pretty close, right?
Yeah, 200K off.
Oh, yeah. Can I make a motion?
You can do whatever you want.
I want to make a motion to move forward. What is this? Is there a number on here? On the last formula?
It's the 3 million cap model, and I can call it proposal 3.
Okay, I make a motion to move forward proposal 3 to the OAC.
No, we don't have a second yet. So I think I just continue to call on folks. I'll have Shannon or an attorney jump in if I need to change my process, but Morgan, go ahead.
Hey, sorry, I missed some of the first part of the meeting. So with Allied being I didn't realize that they were specifically trying to bill for the services that were not billable for Medicaid in that way.
And that's going to be true for every applicant because they need to attest to that in their application, in the technical narrative.
Can we put them back here to $1 million budget, take $1 million from Community Services Consortium and go forward, since they're also a new expanded service of things that were already met?
So we need to check with Keisha because the motion is hers.
Just trying to get, methadone to undocumented and uninsured people would be great.
Keisha?
You're on mute, Keisha, if you're talking.
You said now what?
Put Allied Health back at a very much reduced budget, $1 million total, and then take that $1 million off of Community Services Consortium. Or anywhere else, or take $500,000 off Community Service Consortium and $500,000 off WVP Health Authority.
They're already only getting like $1 million something.
Take $500,000 off Painted Horse and $500,000 off Community Services Consortium.
Sorry. Let me add a 0. I'm sorry, Morgan, what was the other one?
I said the Painted Horse and Community Services.
It's kind of hard because you didn't hear the full meeting to make record. I don't know. But that would be. Because you didn't get to hear the services.
Well, I mean, just trying to find $1 million to keep Allied Health in there at a very, 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 very low amount, and you can take away that $1 million wherever you want. Because so much of their services are already billable. I just want people to be covered. Oh, I forgot about that. You know, first time I walked into a methadone clinic, I didn't have insurance. I had to be the person on the charity case, you know.
May I suggest
Did I
taking
capture it right or wrong, or do you want to change it again?
Well, this is Keisha's motion, so I want to make sure that she's in the driver's seat.
Absolutely.
Whatever you want to do, Keisha. I'm good to go. You okay?
And let's see. Community. I'm just trying to see who.
Would you like me to read it to you, Keisha?
To community. Read what to me?
The motion that I amended the motion, and I wasn't sure if you wanted to amend it. First of all, that's my bad. I'm sorry. Your motion was to move forward the $3 million cap model of Marion County to the OAC, and then Morgan began trimming back some of it. So I put in an alternative motion to move forward the $3 million cap model of Marion County, making Allied Services total budget to $1 million, Community Service Consortium budget to $2 million and change, and Painted Horse budget to 2.5. I wasn't sure if you want that. If you don't want that, we can remove it.
But just quickly, that does get us down to 723,000, and doubtless there will be more debate in the OAC meeting at large. So this is also, Keisha, it's up to you.
Yeah, I don't know that we would go with community. I'm trying to see the budgets real fast. So yeah, move some. I would remove. I know Marion County, they are the CMHP.
Mm-hmm.
Yeah.
I would remove. I would cut them down another 500.
And while Ariana's
maybe
working,
250. I'm sorry.
No, finish your thought. I just see Rachel's hand. I want to make sure she's able to contribute.
I was just wondering if I was able to second Keisha's motion, if that's something I was able to do.
I think Keisha's trying to nail down what her amended motion is.
Okay.
Keisha, I think you're there. I think we got it already.
Yeah, but I don't want to.
Oh, sorry.
All right, let's go.
This brings us down to only 223,000 over. That is really close.
All right, let's go. I amend my motion to move forward proposal 3 with changes.
Second.
Okay, Keisha moves, Morgan seconds. Any other discussion? Questions? Okay, Carly, let's do a vote.
Amy, how do you vote?
Yes.
Keisha?
Yes.
Oh, thank you, Amy. Keisha?
Yes.
Morgan?
Yes.
Abby?
Yes.
Ariana?
Yes.
Ane? I think she's here. Dana?
No.
Daniel?
Yes.
Danielle? She may have left.
Oh, she's still present.
Oh,
Oh, there she
oh.
is.
I said yes. Sorry.
Oh, I'm sorry. I didn't hear you. Elizabeth?
Yes.
Emily? I think she actually left. Gregory?
Yes.
Greta?
Yes.
Hannah?
Yes.
John?
Abstain.
June? I'm sorry, Juliana?
Yes.
June?
Yes.
Kathy?
Yes.
Kylie?
Yes.
Kirsten?
Abstain.
Liz?
Yes.
Mark?
Yes.
Michelle?
Yes.
Nicole Eckler?
Yes.
Rachel?
Yes.
Sam? Is she still on? No, that's right. Sarah Adelhart?
Yes.
Sean?
Yes.
Stanley?
Yes.
Tatiana? She's still on. And Tim.
Yes.
That passes with 24.
Okay, thank you, everybody. I know we're over time. I just want to let folks know that these hard conversations are going to continue, and they're going to it's just going to be hard. So please keep thinking about spreading the money really thinly, or having fewer folks with more funds. It's not easy at all. And thank you very much for the deliberation. Congratulations on finishing Marion County. See you all at our next meeting, and stay tuned for potentially more, because we have more counties to get through. Thanks, everybody.